Hey everyone, today I'm going to be talking to you about all you need to know about depressants. I'm Hashem Abdou and this is a project I'm doing for my health class at CAC. So let's get started. So to begin with, depressants do exactly what the name suggests. They depress a person's nervous system. A more scientific definition would be that they are drugs that lower neurotransmission levels to depress or reduce arousal or stimulation in various areas of the brain, as you can see here on the screen. Depressants do kind of the opposite of what stimulants do, which is to increase brain activity. Depressants are also sometimes referred to as central nervous system depressants, or just CNS for short. Now, what are they used for? Depressants, when prescribed by a doctor, can be used to reduce feelings of anxiety. They can be used to reduce insomnia and other sleeping problems, obviously to help people sleep better, to reduce pain and fever, to relax muscles, to boost your mood, and unfortunately, they are very often used as illegal drugs. Now, there are four main types of depressants. There is alcohol, there is barbiturates, there is benzodiazepines, there are benzodiazepines, and there are opioids. Now, depressants such as Xanax, as you can see here in the picture, Klonopin, Halcyon, and Librium are often referred to as benzos, because obviously short for benzodiazepines. Other depressants such as Amital and Seconal are classed as barbiturates, and they are drugs that are used as sedatives and sleeping pills. By the way, I'm sorry if I mispronounce these words because, not exactly sure how to say them. Anyway, here's a fun fact. Although marijuana is often classified as a mild psychedelic drug, the active ingredients within it do have many depressant effects. And that's why marijuana is often classified as a depressant as well. Now, this is actually pretty interesting. There are very interesting slang or street names they use to describe these depressants, such as disco biscuit or Christmas tree or bluebirds or dolls or fender benders. It's pretty cool to see what people call these. I don't know how they come up with this stuff, honestly. Also, here's another fun fact. The first depressant is suspected to date back to 1832. Can you imagine? So that's about 200 years. Wow. So anyway, there are different types of forms for depressants, or different types of them, as obviously like any other drugs. So they are usually brightly colored pills, caplets or capsules, but they also come in many different forms, such as powders or liquids, as you can see here in the pictures. So there's a powder on top there, on the left, on the right there are the regular brightly colored pills. I'm actually not sure why they're brightly colored. That's something I'd want to know. So, if you know why, just leave it in the comment section below. Also, there are liquids, and yeah, another thing to note is that depressants can be extremely dangerous when consumed with alcohol. In fact, they can be very deadly. Depressants are created in laboratories, obviously, pills, and almost no depressants are naturally grown, but as we saw, marijuana can be considered a depressant, and clearly that's a plant. So, not all of them are created in labs. Now, there are different short-term effects for depressants. Short-term effects are kind of what we went over at the beginning of this presentation, but I'm just going to go over them again real quick. I'm not going to read through everything, just the main ideas. So short-term effects can be relaxation. They can be, so there are some reduced anxiety, stuff like that, but there are also obviously negative effects, such as cold shivers, lack of facial expression, altered senses, stumbling, slurred speech, falling asleep, dilated pupils, decreased body temperature and heart rate. So these are all stuff that you should know are short-term effects. Now, most depressant pills can cost anywhere from about $1 to $50 per pill, depending on the milligrams in the pill. And just to give you an idea of what that is, alcohol, when purchased illegally, can cost about $25 to $30 per gallon. So that's just, to give you an idea on what it is. Now, long-term use of depressants can produce depression, chronic fatigue, breathing difficulties, sexual problems, and sleep problems. So, long-term effects can be very dangerous. Obviously, it can also lead to addiction, which is something we're going to go over uh, later on in this presentation. Now, this is very interesting. It only takes about 2 weeks for you to get addicted to depressants. Can you imagine? 2 weeks. That's very little. So everyone out there, watch out before you take depressants. Clearly, it's very dangerous. Withdrawal symptoms. Obviously, you all know what that means. Withdrawal symptoms are the symptoms that you get when you suddenly stop taking depressants. So you can't be taking depressants for a long time and then suddenly stop, because the symptoms can be hazardous and potentially lethal, actually. So examples of symptoms are anxiety, hallucinations, insomnia, loss of appetite, sweating, weakness, and even possible death. If you abruptly reduce the dosage of depressants or completely take it away, you could die. So you have to take that into consideration. Now, another thing to note is that there are legal and illegal depressants. Some depressants can be bought illegally, and some are prescribed by doctors. If you get caught using illegal depressants, which is basically just like any other drug, you can risk getting a criminal record, you can get fined, or you could even go to prison, depending on where exactly you are and what exactly you've been doing. Now, there are different treatments. The objective of treating them is to help patients not only overcome their physical dependency, but also psychologically. Um, so that's also something that is very important. So you go through medical detoxification. What does that mean? That means that you physically detoxify your body from these drugs. But apart from that, you have to go, or it is recommended that you see individual or even group counseling. You could see behavioral modification therapy or even family counseling in order to, treat yourself also psychologically. So here's another rather sad fact. In 2015 only, more than 10,000 people died of benzodiazepine overdose in the US. I'm sorry, once again, I pronounced that. I'm sure I didn't say that properly, but I mean, you get the point. So that's a lot of people, and that needs to change. Now, if you happen to live in Egypt, or in Cairo to be exact, there is a very good clinic that you could visit for treatment. This is also part of the health project. I mean, I should attach the location and the phone number of a specific clinic. So here's one. It's called Flochi Wellness. It's actually pretty close to school, and it's they do these kinds of stuff. So ring them up if you know someone who has an addiction problem, or if you yourself do. So yeah, that's it. Here are some of the references I used throughout my presentation. Check them out if you'd like. Also, none of the pictures that I put in my presentation are mine. I do not own them. And yeah, that's about it. I hope you enjoyed, and I hope you found this interesting and useful. If you have any questions, just email me or write them in the actually, no, don't email me. Write them in the comments below, and subscribe and do whatever you like. Okay, that's it for today.